I'm going to be talking about the things that PTs have to consider when working with particular special populations. I'm going to be talking about three different types of special populations. The first being hypertensive clients, so clients that have high blood pressure. All high blood pressure is just your heart when it pumps blood. The pressure in the arteries is more than it should be, so it's greater than normal. So the main thing you have to consider as a PT when working with hypertensive clients is not doing any exercises or putting them in any position that's going to increase the pressure or workload of the heart. So that may increase the chance of them having some sort of cardiac event. So first of all, we have to get clearance from their GP just to see if they're actually allowed to participate in the gym program, and also learn a little bit more about how they deal with their condition. And then we can get into different exercises and modifying them from there. So first of all, with our limbs, we would make sure that they never go above the level of the heart. So our arms wouldn't go above our head, or if we're in a lying position, our legs wouldn't go above the level of our heart. And we also wouldn't do exercises where they're going to hold their breath for an extended period of time. And we also wouldn't do exercises where they have to rapidly change positions and go from different positions to another. Okay, and in our program that we showed earlier in the video, for example, when we did the dumbbell chest press on a flat bench, to modify that, we would do a incline push-up to start them off. So just on a normal bench with the feet on the ground and just doing an incline push-up that targets the same muscles as a dumbbell chest press. The next special population I'm going to talk about is clients with lower back pain. So that is any sort of pain, so acute or chronic, in the lumbar region of the back. Again, we want to first of all get clearance from their GP that they're allowed to participate in a gym program. And same again, we don't want to do exercises that are going to place extra strain on the lower back region. And so then once they're allowed to participate, we can modify the exercises from there. First of all, with a front squat or a back squat or anything like that, we can simply do a gym ball squat against the wall with the gym ball just in the small of their back, telling them to activate their core. That's going to reduce the stress on the lower back. And also things like deadlifts and upright rows. You probably wouldn't do them with a client with lower back pain, as that's going to directly place strain on the lower back. So lower back pain arises a lot from poor posture and strength and weakness imbalances in the lower back, hip and upper leg regions as well. So they may have an exaggerated lordosis or tight hip flexors as well. So you may have to, depending on how they manage their lower back pain, you may have to refer them back to the GP or directly to a physiotherapist, so that they can actually improve their lower back pain. The final special population we're going to be talking about clients with a shoulder injury. So shoulder injuries can be anything from a dislocation, a muscle strain, tendonitis, bursitis, impingement in the shoulder. So again, we want to communicate with the GP and the physiotherapist about how severe their injury is. And also with communicating with the client themselves about how they've managed the injury in the past, what exercises they do to rehabilitate the shoulder, and also learn about what exercises actually does aggravate the injury and pain. So we'd stay away from those sort of exercises. So most likely we wouldn't want to do exercises that impinge the shoulder. So we wouldn't be doing lat pull downs, any trap shrugs, any upright rows. We would also modify the shoulder press so it's more out in front of their body, so more of the load's being taken on by the chest. But again, we'd be communicating with the client constantly so we're getting constant feedback about how their shoulder pain is going and if anything is bringing it on in particular.